The pain relief routine Rumba will feature mobility and stretching exercises to ease pain. For this, you will only need a pillow to support your head and be comfortable, and a mat so you don't hurt yourself when lying on the floor. Alright, let's get started. So I lie on my back and get into a comfortable position. Pay close attention. I'm bringing my knees not toward my chest, as that would make them too close together. Let me show you with this camera, but more outward, toward the shoulders. I want to bring that knee to the outside. This is going to allow me to have more hip mobility and make it a more effective movement. I just want you to hold that position and bring your knees to your chest 5 times. We push, round out that lower back area, hold for a couple of seconds, relax and push again. With this movement, what we achieve is relief of tension in the lower back area. We push, 3, relax, we push, 4. Last repetition, push, 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 39, push, 40, push, push, push. Push, 80. Damage. Modification. And what I do is transmit this mobility at the lumbar level towards me, outward, downward, towards me, and as you can see, it's my arms that move at the same time as the lumbar area. The legs stay fixed at all times. We're going to do 10 circles to the left and 10 circles to the right, 1 with rhythm, 2. Very good for relaxing the whole lumbar area. 3. 4 towards me, to the left, down, 5. 6. 7. 8. And the bigger that circle 9 is, the more effective the exercise will be. And 10. I go up a little because this exercise has the peculiarity of pulling you down. And now we're going to do another 10. Remember, fingers to the left. We'll switch cameras for another angle. Let's go. Left down, right up, 1. Left down, right up, 2. Left down, right up, 3. 4. 5. 6. Very nice. We feel warmth in the lumbar area. 7. Mobilization. 8. 9. Last repetition. 7 and 10. Very, very good. We rest our legs on the floor. Take a breath for a moment. Let's switch cameras. And now what we're going to do is a stretch for the hip rotator muscles, which are very important for lower back pain. I want you to cross one leg over the other. Pay close attention. I'm resting my ankle roughly at the level of my thigh. From here, I want you to put your hands through, one on the inside of your legs right here and the other on the outside, and both join together underneath. Okay, I know some of you have trouble with this, so you can use a towel, a cloth, whatever you want. We put it in on one side, take it out on the other side, and look, we have a good tool here. A gadget that will help us bring that knee toward the chest without pulling too much on our back or our hands. From here, what I want is for it to be nice and high under the knee and to pull toward me. What are we going to notice at this moment? Tightness. Where? Especially here, at the level of the right buttock. Okay? It's the leg that's crossed, it's the leg that should feel tight, and I hold the position. You don't feel much tightness? You can adjust that foot a little bit, more inward or more outward, as you see on the screen. So it's a different angle and you feel different things. Here your arms are engaged. Hold the position and count to 30 together. We're already at 5. 10, 11. 28, very good, very intense, very good sensations in the right hip area. And the more those external hip rotators are released, the more your lower back area will also be released. Very good, we've done 30, let's put that foot down. Watch closely. I want to cross my leg fully. I'll show you. One knee up, the other close, both knees together. This is what I want now. Make sure to bring both knees to the floor. The lower back rotates completely. My left hand is going to rest on the leg that's on top, giving leverage. and the opposite arm opens outward. And this is where we really get into the core of the exercise. When it opens outward, a very significant lumbar rotation occurs. And it's very pleasant, as it will stretch all that musculature, especially the quadratus lumborum. Our little right arm, hold on, which camera is that? We're going to let it fall outward and try to keep the knee in contact with the floor. This arm clearly won't reach far back or low. Take it as far as you can and enjoy. Close your eyes, take a breath, let it out. And notice how with each breath, rotation keeps increasing. We'll do 5 breaths. I take one. I let it drop. That's 3. Let's do the last 2. I'll change your view. Let's go. Last one. Very good, but this isn't the end, okay? Pay close attention. I want you to stretch your leg all the way down. I want you to bring that foot in. It's not easy. Not everyone can do it. The foot was here. I brought it in until it's resting on the ground. Hold it tight with your little hand, because otherwise it's going to slip away. Pay close attention. And from here, I want this knee to move toward the left shoulder so that this space gets smaller. You'll immediately notice another stretch at the glute level. Very good, okay? What do I recommend? If you don't feel it, try moving your foot a bit, okay? We can move it outward, inward, downward, but not too much or it can't be grabbed, or upward. You could even use this here to put less strain on your arms. I don't recommend it, but you can use it. And from here, once it's well anchored, what we're going to do is push that knee, and we're going to feel that tightness at the hip level. We're just going to hold for 15-20 seconds. Close your eyes. Very good. Awesome. One more. Perfect. And now you'll notice how, when you return to your starting position, hey, well, your right hip and lower right back feel looser, right? Let's make the most of being here and lie on our side to do another side kick, an exercise for hip and lower back mobility. Very, very good. Pay close attention. I position myself on my side. My knees are bent, the bottom leg is bent, and the top leg is completely straight. I want the tip of that foot to be facing forward, not like this, which is wrong, but like this, which is correct. From here, place the opposite arm here without moving your torso. I want you to bring your leg forward, as if you are going to kick, and then we go back. And right here, look, I point my toes down, toes forward, I kick, toes right here, bam, down and back. 2, toes forward, toes backwards, very good. The chest area stays very still without moving. The movement happens at the hips and, secondarily, here at the lumbar area. Forward, I don't know how many we've done, 5. Let's keep going. 6, that's it. Let's go all out. Backwards. Forward, 7. 8. 9. And 10. Very good. We've done a lot of work with the right leg. We support it, we rest. We notice sensations compared to the left, and now we basically have to do the same thing with the opposite side. Alright, I'm going to do it from here so you can also see how the exercise looks from the other angle. Very good. Which was the first? Do you remember bringing this leg across with the ankle on the thigh? I place my hands, one here. I'll switch the camera so you can see the other one out here and from here. I want to pull my knee to my chest. If it's too hard for you, remember that we can use a small cloth that we place between the knees. Okay? Easy to visualize. And from here I pull up with my arms. Where am I going to feel the tightness? Very simple. Here at the glute level. I hold the position for 30 seconds. Small swings. I really like them. I like them. I like them. 10. Is it normal to notice different sensations between one side and the other? Don't think that we are completely symmetrical, because that's not the case, friends. We have many asymmetries and different muscle tensions, especially because we are dominant on one side. Always. Good. I'm not sure how long it's been, maybe 30 seconds. From here, what I'm going to do now is cross my legs completely and make a little space. I'm going to remove the mic. I'll let my knees drop to the floor. Look closely. I let my crossed knees drop toward the floor. From here, what's going to happen? Well, the left shoulder lifts up. Completely normal. We're going to place my right hand exactly on top. We change this here, the left knee, so that it stays firmly on the floor. We open the opposite arm outward, and an axial rotation occurs at the lumbar area. From here, we take a breath, exhale, and try to separate this shoulder as much as possible from the knee that's on the floor. The key is that the knee stays down. It's okay if this arm doesn't reach all the way down. We take a breath, exhale. We close our eyes, let ourselves drop completely, let ourselves. One more. Very good. Next, I stretch my leg down, I bend the leg up, and from here, what we're going to do is bring that foot up close towards my shoulder, which I'm going to anchor with my right hand. I have the signal here. Perfect, we can see it there. And on the other hand, with my hand, I want to bring this knee closer to my right shoulder. What I'm going to do is simply pull it towards my shoulder and keep the position tight. We're going to mark it here at the glute level, but in a different way than we did before. We hold the position for 15-20 seconds quickly, and if you see that is not stretching enough, you need to change the position of that foot. Higher up, lower down, more forward, more backward. I'm just going to hold there for 10 more seconds. Enjoying the movement. Very good, and 0. From here, we make few changes. Move into the side kick position. Side kick. Pay close attention. I want the bottom leg to be bent, and I want the top leg to be completely straight. And from here, what we're going to do is kick forward and backward. I get comfortable, placing my left palm on the floor. What I'm going to do is move that leg back, toe pointing down, way back. And next, toe forward, leg forward, as far as you can go, leg back, toe pointing down, extension. And next, leg forward. As if you were kicking a ball. What are we doing? Mobilizing the hip, but at the same time, it's also the lower back area that's being mobilized. We've done 4. Each person reaches a different point within their own limits. You don't have to do it like me, either as well or as poorly. It's not about doing it or not, but about everyone doing it at their own level. Backwards and forwards, 4 or 5, I don't know. Leg back, toe pointing down, leg forward, toe pointing toward me, and toe pointing down. Toe pointing toward me. 4. Down, toe pointing toward me. 3. Toward me, 2. 3. Toward me, 1. Last repetition. And toward me. Very good. Let's relax. Let's breathe a little. Great job on both sides. Next, what we're going to do is turn around and lie face down. To finish with a quadruped exercise, so I get into a quadruped position. Remember? Very good work that we can do in the quadruped position. Wrists under the shoulders, knees under the hips. We'll do a cat-cow movement now. Everyone likes it, so pay close attention. First, I bring my belly button toward the floor. Arch my lower back as much as possible, and then I pull my belly button upward. My lower back rounds out and my back ends up forming a big C shape. I inhale downward and that belly button arches downward. I exhale and round my back upward. 2, inhale down. and exhale and pull in that belly button. That's it. 3. Let's go for 10 repetitions. 4. 5. 6. Let's finish up. Lower your belly button, then lift it toward the ceiling. 7. We can also move the head along with it. Let go. 8. 9. And 10. Very good. We continue stretching, Magometano. Pay attention. I lower my feet so the instep touches the floor, let my buttocks rest on my heels, then move my arms forward. We switch the camera forward to stretch the entire lumbar and dorsal area. We can take little steps with our fingers to add more tension and hold the position. We're going to do 10 seconds in the center. Let your head drop, the body sinks. Next, look, we move our hands to the left until we start to feel more tension here in the right lat. And again, we hold for 10 seconds. 10 seconds. We move our hands to the right. Same procedure, okay? We let the chest drop, arms reach far, we take small steps, it starts to pull on my left lat, and I hold the position. Let's change cameras so you can see. Great. Flexion work, then we'll end with excellent extension work. For me, an essential part of this routine is because we're often in flexion, sitting and leaning forward. Well, it's ideal, it's important that we also work on extending the lumbar area. For this, we're going to lie face down. We'll place our hands on the mat and rest our head on our hands. And we're going to see how it feels. How are you? Are you okay? Is it a comfortable position? It doesn't cause you any discomfort or pain, does it? We can move on to the next level, which would be placing a cushion right under your chest. We wouldn't be supporting ourselves with our hands anymore, but instead we'd place our elbows a little bit forward and keep the head more elevated. We're now doing a more intense lumbar extension. Stay here for about 5 minutes. If you're comfortable, we can move on and remove the cushion, placing our arms in a triangle with the chest higher. Pay close attention. Here I already start to notice a great extension at the lumbar level. The important thing is that the pubic area is well supported on the mat and that it's a comfortable position for you. Why? Because we have to hold the position for about 5 or 6 minutes. Has this position worked for you? After 5 or 6 minutes, do you like it? We can try something more intense. Place your hands on the floor, push and lift your chest. Be careful, as this is a much more intense level. Here, we're not going to stay like this for 5 minutes, but instead we're going to do 10 repetitions. Then we hold for 5 minutes and do 10 repetitions. Why am I telling you this? Because you're going to have to work on this last part by yourself, alone. Pick a difficulty level you like that's somewhat challenging but not too hard, and stick with it. Lumbar extension is one of the most important things, especially when we have some kind of lumbar disc disease, herniated disc, protrusion, or even osteoarthritis. Once you've finished your 5 minutes, or your 10 repetitions plus 5 minutes, what we're going to do is lie face down again. Slowly. We stay here for 30 seconds. Next, we're going to lie on our side with our knees bent, 30 seconds, and finally, slowly, we're going to sit up. Why do we do this? Because your spine dislikes shifting from extended to flexed sitting positions. That's why you have to go very slowly, especially if you have frequent pain, so your body can get used to it without any sudden movements. Alright, and with this last exercise, we've really reached the end. It's very important to exercise regularly, to do it 3 or 4 times a week, set aside 20 minutes, and dedicate them to your health, which is truly the most important and valuable thing we have. And if you also combine it with the red light we've been using today, those pain relief effects will be multiplied. Thank you very much for making it to the end of the video, and I hope to see you again very soon in one of my other videos. Bye, friends.